what you should know about Chris Grow is on his website. He built two organizations recently that he will talk about today, which of course is Stratify Health and the Catalyst Health Network. Started out with Village Health Partners and Legacy Medical Village in Plano in 2007. They now cover 1,000 primary care providers with over 1 million lives across North Texas. So his organization also has, what do you call it, value-based contracts with the 4 major carriers, Aetna, BCBS, United Healthcare, and Cigna. He's got and received many accolades. He is an all-around top person to know, high quality, high integrity, building things the right way with the right motivations, and having an ever larger impact, not just on our community, but also on business models that can work in healthcare without leaving people behind. So I want you to meet Health Wildcatter's mentor as well, and a great leader in our North Texas community, Chris Grow.
Go back to that slide, please. Lindsay, the one he was on. A couple things to point out. Process re-engineered that guy a little bit. I lost like 15 or 20 pounds. So I got to remind me I got to update that picture. And then he also said I could talk about whatever I want. So I'm going to talk about whatever I want. I'm going to give you some more stats today real quickly to kind of let you understand where we are. Because if you did go to our website today, and if you see this right here, that's really not who we are. We've changed a lot even in this year. And if you come back and look at our website in about 7 to 10 days, you won't see this brand anywhere in what we do. So that's kind of part of how you evolve as a company and as an ecosystem. We do think of ourselves almost as a mini PE firm where we have multiple companies we built along the way. Catalyst Health Network will remain, but ultimately we're elevating our brand to Catalyst Health Group, and you'll see some series of things around that. I'll come back to that. Oh shit, Patrick Kelly's here.
Boy, this is
Oh my gosh. Oh my gosh.
You didn't give me any list of people to exclude.
Yeah, I'm sorry. That's my fault. My fault. Yeah, I have a restraining order on him, but so sitting in the back. That's good, I guess.
One row back.
And I think I guess we have maybe a few people online, but who's here today? I mean, it's such an intimate group that I'd rather make this more conversational. I know most of this row.
Josh Theodore. We actually worked together when I was an architect at a firm that did build children's projects.
Okay. It's kind of who do you guys are? Moss Adams is here. Who's Moss Adams? Okay, you're doing my audit right now, so we should talk. Who else is here?
Marquis Dima with the brand companies for design build, MVP firm.
Okay.
I'm back from the smoke side and professional.
Okay. Real estate.
I'm Craig Primo with AIM Healthcare, so we're workforce technology staff.
Okay.
Chuck Mabel, MedLife, population health management, former answer.
Okay. Cool. Normal transition from a hand surgery. Yeah. I get it.
Robert Brown, mentor here. Health Wildcatter is also with the Vail Medical, bringing more modern primary care programs to senior living.
Cool.
Connie Lucy, I'm co-founder of Synthetic Lab.
Did I not hear from anybody?
Scott Annis, I'm with Health Tech S Group, rural community hospital management.
Okay.
I'm Neil Shaw, internal medicine physician, but now
Okay.
so I'm first time on I started my life at cancer patients. Try to be the
So you're a first-time entrepreneur, you say? Who thinks they're an entrepreneur here? Who calls themselves that? Okay. All right. Who actually is?
Frank.
Oh, I missed one.
Frank Jerome, a company called Star Frank. It's orthopedic trauma.
Gotcha. Who's in a position where you're leading your company in a way where you're making day-to-day decisions at a high level? Okay. All right, good. All right, just wanted to kind of see who.
Well, online, we've got about 30 or so.
Okay. I won't go through them, but hello, and nice to virtually be with you this morning. You know, I'll tell you a little bit about Catalyst and what I just felt like talking about today is, you know, why we do what we do. And you all have your reasons why. If you don't have your reasons why, then this might be interesting and may make you maybe ask yourself some questions of why you don't have a reason necessarily deeply why. You do what you do. So a little bit about me. I'm sorry you didn't get to tell your story because I'm sure it's fantastic and it's always interesting. And I grew up in a little small town. It's a mini health desert. So I'm appreciative of what you're trying to solve for. And certainly we have a lot of business out in rural Texas as well and Oklahoma and are trying to solve some of that as well. So I grew up in Hillsboro. You might know where Hillsboro is. You might not know where Hillsboro is. You're pretty close. You might. You go through it when you go to Austin or Waco, and you don't really stop unless you're running out of gas or unless you get stopped. That happens. That happens too. The outlet started in 1989 when I was graduating high school. They were out of business by about 94 because the internet happened, right? So it was awful timing for our little town. We thought we would hit the big time, and it really actually set us back. There was 3 physicians there, and those 3 physicians, of course, they you know, swabbed my throat, gave my shots, and took care of my family when we needed. But more than that, they were really visible in my little town of 7,000 people. They were on the school board, they were on the city council, they were the mayor, they were the head of the Methodist and the Baptist and the Presbyterian Church, which were the 3 churches we had in town. We didn't have anybody on the Catholic side. And then, you know, they're of course on the sidelines of every football game, which the whole town was. So they were very visible in taking care of the town in more ways than just when I come into the exam room. And that left a mark on me. The other thing that left a mark on me about them is that, anybody know what happened in 1987 in this country? Branch Davidians. Good one. Yeah, that's not where I was going, but that did happen near our town. There was a big savings and loan crisis. I don't know if y'all saw about that. It was big. So that bankrupted my family. So that was pretty significant moment in my life. But you know who it didn't bankrupt? Those 3 docs. That was meaningful to me to see at 16 years old, trying to figure out what I was going to do in life. I thought, man, these doctors, there's two guys and a girl, and they had stable families. They were really helping their community. And I'm from Hillsboro, Texas, and that's all I saw really as what I would think my success looked like. So I decided to be a doctor. I was smart enough from a small enough town where I could get into University of Texas, and then I figured out, you know, I'm just piling up debt. Like, what's the fastest way to medical school? Some of you may have heard this story. And so I become a zoology major, which I don't know what that is, but it was the quickest way to medical school. And so then I go to medical school, and I don't really know. I like sports a lot, you ortho guys. And so I couldn't play in the NBA. So I was thinking maybe orthopedist, but you know, the family physician thing was just really what I was interested in because that's what I saw growing up. And it's so important that we don't appreciate it. It's like what you see when you grow up makes such a difference in what you're doing today. And if you can't make those breadcrumbs back, I would encourage you to, because it's going to get to what I'm going to probably talk about here in a minute. Maybe some questions you might have around that. And so I go into medicine, and I decided to start my own practice because everything I saw, this is where the things started coming online for me. And medical school and residency, I'm doing this in the 90s. So those of you remember the 90s, the rise of the internet, the rise of consumerism. Healthcare, if you're sitting where I'm training most of the time in a hospital, is a miserable place to be. There is no consumerism going on in healthcare. It makes no sense to me how we do things. There's the computerization, the digitization is beginning of electronic medical records at this time. And the old school physicians that were old school in the 90s that are dead today, probably, you know, we're like, this is the stupidest thing ever. Putting stuff on a computer, you know, your pen and your paper is God, you know, and that's what's influencing. It's why you get some of the slow traction in healthcare is because we're so ingrained in our education in a way that's so archaic in the past. It's individual based, not team based, you know, hospital centric versus actually health centric. It's where our training is. Our training is not out in the rural areas where people need to be cared for. They're in the hospitals where people are already way, way sick. So I'm going through that going, this doesn't make sense to me on how I'm experiencing the world. I decide to say that I'm going to make a difference. And I don't know what that means, but I know that I'm going to do something different. And so I open a practice in Plano, Texas in 2000, and actually quick little off ramp. I open a practice. I join this group. They have the paper. They do. This is 2000. They're doing scheduling on a spiral. I think Plano's probably a good spot. I looked all around Texas. A friend of mine kind of put me on it. HCA gave me a guarantee. Day two, there's two people. There's a lady who is practicing as a hobby because she's independently wealthy. Red flag number one. And then the other guy that's in there, I find out in day two, is drinking at night. And then in the morning is taking stuff to kind of pop him up again. And he's zigzagging all throughout the day. And by day two, I'm supposed to do an intervention to remove him from the practice. Day two. So that was something. Yeah, my wife is in tears. You know, we had just bought a house. Well, we didn't buy it. I mean, it was zero down because I'm a doctor. So surely you'll be able to make the money to pay for it. But at that point in time, we were scared to death about that. And so we quickly moved through, and I find a way to leave that practice and to say, if these yahoos can do this, I can do this. I'll figure this out. And that's kind of the moment of entrepreneurship that kind of started. I was kind of forced into a different decision point. And so then I started to really have to think about, well, what do I care about and why? And so I would say that, you know, that the next 4 or 5 years, as I started a new practice with my partner, I started to spend a lot more time on the business side. I went and got an executive MBA at UT here in Dallas, where there was no other doctors I had to hang out with, which was great because in the doctor's lounge is a miserable place. You just bitch and complain all day. All right. And you just had to get out of there. I mean, the food was free and that was cool, but you got to get in and out or it just brings you down. And so it was awesome to be around people like you that aren't physicians and talk about things that you're dealing with. And a lot of things are the same. What's the number one thing we're all dealing with? People. You deal with people in any business that we're in. The number one thing you're going to have to manage on a day-to-day basis, people more than ever right now. And so just learning those things and those commonalities across industries and across businesses was really helpful. And then as we started to grow, I started to be able to look at, if you saw what was going on, if you remember the early 2000s, before the financial crisis and then during, is you had this massive consolidation. If you were in this market in 1995, there was only independent physicians. There were some hospitals, but then this mass consolidation happened. And why did consolidation happen? Oh, because that helps. That's better for business. Consolidation will bring down prices and you'll have more efficiencies and effectiveness. And all these health systems went and did that. And they gobbled up a bunch of primary care physicians and specialists. And what happened? Prices went up. And so you get it from an academic standpoint of that the consolidation might help because you've seen that in other industries. What's different about healthcare is that there's no transparency of how the sausage is made. So therefore the pricing is all over the map and it benefits the people providing the care more than those that are paying for it or receiving it. And so that became online to me about 2008, 2009, as we were an early patient-centered medical home. And what I could see in the data as part of being those type of contracts, if you know what that means, I was in all these early value-based contracts, the first in the state with Blue and United, Cigna. You can see these massive differences in costs. If all of you were taken care of by pick the system, Texas Health, whatever, and all of you were taken care of by me, and you actually had the same risk adjustment score, you know, you were 20 to 30% lower in costs just because you weren't getting your care somewhere else. It's the difference of going to, you know, Burger King and McDonald's, which you think you're getting a burger, and one being significantly higher. Like, why? Why? If you couldn't really tell the difference, like, is there really a difference just because of what door you went in? And so there was a moment, I remember this moment, it was like, y'all seen Jerry Maguire? You know, when Jerry Maguire goes, writes his manifesto, then goes out, and I didn't have anybody to go really.
Saw that video yesterday.
Oh, you did? So I go to this coffee shop, White Rock Coffee Shop one night, and I write for like 5 hours and about kind of how I'm thinking about all the stakeholders and how I think about our purpose and what really mattered to me. I didn't have anywhere to go into the next day to deliver that and get fired since I worked for myself. But it was really an important moment. It gets into kind of what I wanted to kind of, I guess, say today, because we've grown to this cool nationally known organization called Catalyst Health Network that has, you know, well over 1 million lives that we care for in a value-based contract. We absolutely save tons of money. It's a different relationship with the physician and the patient and whoever's paying. We do all populations, Medicare, Medicare Advantage. We've not figured out how to do Medicaid yet well. And we've launched a foundation 18 months ago where we're doing a lot of work down in the southern part of the Metroplex, where we're building not only testing and vaccination point solutions for those communities that wouldn't otherwise have it, but also starting to build clinics, virtual clinics inside churches and community organizations that are trusted, where we can start taking care of people who are in these health deserts that are sitting 2 miles from us, where there is no pharmacist, psychologist, nurse, doctor. So all of that has been built because I had a singular purpose back in when I was about 36, 37 years old around helping communities thrive. Stop right there. And kind of that's the drill for today, for me to you, is that I kind of found some energy came into me that night that told me that my life was about helping communities thrive. I just happened to be a doctor. I happened to be in healthcare. How did that make that connection? Let's go back to those doctors in Hillsborough for a second. What were they doing? They were helping their community thrive, like literally all over the town, not just at their 9-to-5 job. I mean, they were running the hospital and delivering the babies and doing the surgeries and that time. They were those type of family physicians. But then they were doing everything else too. They were in the churches and the politics and the athletics, and anything you needed, they were there stepping up. And they were my mentors. And so I during that moment of seeing that difference in cost, thought, well, I don't want to be mayor. I'm not going to be on the sidelines probably anywhere. Like, how can I be that? How can I help communities thrive? And it really came online to me. It's like, if I do not do something, or if someone doesn't do something, then we're going to see mass consolidation of this market into 2 health systems. And we have other markets in this country who have this, and the cost will go way up, and they will have all the leverage for the rest of their life. And they will have the branding that's awesome. And they will say that they're not for profits and they're Christian-based organizations run by nuns. And they'll just be fleecing the community from a dollar standpoint, from a cost standpoint. All of you and your jobs and in your pocketbooks, the costs are just going to keep rising. Our millennial friends that are out there, they're going to end up paying for half of their earnings over their lifetime are going to go to healthcare. Ridiculous. And so at that point in time, I just said, we have this little saying, you may have heard it before, if not us, who, and if not now, when? And so we said, okay, it'll be us. And so we've been working on it ever since, and I will the rest of my life, to make sure that we leave this place better than we found it. I mean, we're pretty damn lucky to be here. I mean, what are the odds that we're sitting here today in 2021 with all this possibility? I mean, what if we were born in like 1850? What would that be like? What if we were born in Peru? What would that be like? What if we were one of the, I don't know what it is. I used to know this in medical school, like millions of sperm that didn't make it to the egg. That one time, all the different times. And what if our parents didn't find each other? And what if they didn't have the, I mean, you can just keep going. And how fortunate we are to be here. And so to not be aware of that and purposeful of like, what are you going to do with this life? Is to me maybe the saddest thing that I could imagine. is not being aware of how great we have it. You all are entrepreneurs and you're leading your company, so you're in positions that matter, and you're trying to do things and start a new business. I would just make sure that you can answer the question of why you're doing what you're doing. You seem to have a story behind what you're trying to do, because it makes your success rate higher. That's the other fun thing. It connects. If you can have a purpose, if you can know what you're doing, you will have a higher success rate, because when the going gets tough, you actually have a foundation to go, or a filter, you could say, to say, I'll keep going. I've built so many things that don't make money, but they were all in the service of, hey, how can we do this to try to help communities thrive? I'm still private. We're way past VC, when we're way past small private equity. We just dink along. And if you know the phrase from the NCAA basketball tournament about surviving and advancing, that's our little coin phrase sometimes. It's just go year to year, survive and advance the next year. And then all of a sudden you look up after 8 years and you're pretty big, because you had this filter of helping communities thrive. The other filter besides purpose is values, is how are you going to make decisions about what matters, not just your why, but how. And so our core values are, obviously we're purpose driven, but there's 3 others that matter. One is that relationships matter. Let me tell you a little bit about that. That's our number 1 core value. If you walked into our new headquarters and you look to the right, which is our main visitor center, to where we'll meet with people, on the door, it says relationships matter. We believe in what's called a stakeholder model, to where you think about who are all your stakeholders. This is where, if I had one slide, I'd put this up. Who are all the stakeholders in your business? Who are the stakeholders in your business, Jesus?
Starting with the community.
Okay, the community is a stakeholder.
Yeah, the community, the surgeons who work with, the physicians who work with
So the physicians,
us.
yeah,
And the number 1 stakeholder is, for us, is God.
oh, there you go. God's a stakeholder for your business. Okay. What about who do you think stakeholders are in your business?
It's mostly the community.
Most of the community.
Yeah, so they're the ones, obviously there's doctors, but we focused on the ones that you're providing service to, and, our entire focus is on.
Robert, what do you think?
Senior living communities that we partner with.
Yeah.
Physicians, our group.
Yep.
Patients.
Yep. There you go. There's lots when you start thinking about it, right? So for me, it's our employees. It's a really important stakeholder. Don't forget. Nothing. Remember, I told you the number 1 problem we were having collectively in my executive MBA program was we were all talking about our people. So they must be a really important stakeholder for your employees. Nothing actually gets done without them. And so your employees, who are your customers, it could be patients, it could be physicians, it could be senior living centers, it could be other community health centers. Who are your strategic partners? For us, it's hospital systems. I bang on hospital systems a lot, and at the same time, they're a stakeholder. I bang on insurance companies a lot, and they're a stakeholder. So, and the idea is of, and this is a very narcissistic, self-absorbed type of comment, but in the stakeholder model, you actually put yourself in the middle, and then it's like a hub and spoke. Who are your stakeholders? So I said employees, physicians, hospitals, insurance companies, strategic partners, and so forth. And then the filter is, when your core value is relationships matter, how do you make decisions through that filter that is a win-win-win for all those stakeholders? That's hard. That's hard, but it really helps your focus. But when you do it, if you can find the solutions or decisions that do hit all those stakeholders in the win, because I can tell you, if one of those stakeholders is taking a big loss in your decision, you're going to be pushing uphill. What if it's great for the doctors and the hospitals and the insurance companies, but bad for my employees? How successful might that be long term? Or what if it wasn't good for the doctors? It's great for my employees, doctors who are, the consumer or customer that we work through mostly, and it's not good for them. What's the chances of that really being something that works out over long term? Not good. So relationships matter. how do you, and if, how do you actually make sure you get the win-win-win? Because if you're helping all those stakeholders, if they feel those, whether it's an organization or an individual kind of group, like your employees, if they feel that you're really investing in them, what happens naturally as humans? You reciprocate. That's why when I smile, you smile, just like you do, right? When we push forward and help and say, we really want to understand what's important to you, insurance company, hospital, in a genuine, authentic way, and think about what's the problem we're trying to solve. How can we make sure it's not one that hurts you? When you do that enough, you create win-win-wins. You go a little bit slower sometimes, but that's a really, for us at least, part of a winning formula of knowing why you're doing what you're doing and making sure your relationships that you're working on in the stakeholder model matter. Then you get into things like, and it kind of connects to the last statement, is our next core value is to serve others first. And that's just a general orientation to that win-win-win-win I was talking about. How do you think about those different stakeholders as what's important to them? And then take an individual stakeholder like our employees. We talk to our employees all the time about how do you, in a team, in a collaborative way, how are you helping each other grow and develop? We tell our young leaders that the best way for you to continue to grow and develop is to make sure you're teaching someone else how to do your job. Work yourself out of a job by supporting others to rise up and take your position. That's the best way to help others be successful. And then lastly, when you're in that kind of collaborative type mode, then there's a premium on, and it's one of our core values, is to inspire creativity. It's a lot easier to inspire creativity when there's resource constraints, actually. I would say we purposefully are resource constrained, not just for that reason, but because we just didn't want to take on any other capital. I didn't want another stakeholder. It's hard enough for me to hit all the stakeholders I got because no one said it, but your investors are a really important stakeholder. Ask every public company, ask anybody who's taken money from a VC or PE. It's a really important stakeholder. We just have chosen not to do that yet. So we get a little more resource constraint. So we have to be a little more creative. And so that needs to be a really important core value. What we're trying to do to disrupt healthcare, that's such a kind of a trendy term, but to really actually just do healthcare different, because it's not done well in this country. There's so much work to do, and I'll spend the rest of my life working on it. And we still won't get there probably, but you can hopefully leave it better than we found it. It's going to take a lot of creativity because the status quo is the hardest thing we're up against. I just did a podcast last week with anybody know Dr. Zeev Netowrk? Y'all listen to his podcast, Changing Healthcare, out of North Carolina. I guess I should recommend it since we were on it last week. And it's good. I do think it's good. He's got a book called Redesigning Healthcare too. That's really cool around. It's more of a kind of a business consumer marketing focus around that. Worth a 40-minute listen. But we're going to have to be creative. That's why you all are doing what you're doing. And as entrepreneurs, it's why there's a business here, because there's all kinds of opportunities. But for us, that's another core value. So I guess that's kind of me today. I can tell you more about kind of where we are at Catalyst, but I thought it'd be, since Hubert gave me carte blanche to talk about whatever I wanted, I'm about to go to a conference where for the next day, we're more of a reunion of sorts around kind of a 10-year journey of personal development, leadership that I've been on. Because we always say that, or this tribe of us always say that leaders get the organizations they deserve. And so I take that as on me. I am the bottleneck of our business. So I need to make sure we're very clear, and my ceiling is the ceiling of the business. So how do I continue to raise my ceiling? And what I found is being really clear early on about what your purpose is and your core values that you're gonna have a filter to push things through, and understanding that stakeholder model has allowed us to be successful. I think there is no, as far as I can tell, there's no boilerplate on how to be a successful entrepreneur. I mean, it's like a scatter plot of ways to be successful. I mean, there's some basic stuff here that you're learning around getting legal and financial and some basic advice for sure. But then your path and where you take money and when you don't, what markets you hit and which ones you don't, the decisions you make, those are all over the map. And there's no way to go do that. There's a way there isn't some other things. And so I feel like this is one of those ways that actually does cross across all companies that's available to all companies and to all individuals. I don't think it's actually consumed and integrated, but I think those that do have a higher chance of success when they understand what their purpose is and have some values that they're putting all their decisions through. Because otherwise it's a very distracting world, and you're gonna get caught off guard all day long by shiny objects and revenue here and revenue there. If you don't understand why you're doing what you're doing and what's important, then you'll get pulled off sides, and it just lowers your success rate from my experience. So what I'm encouraging this group to do, if you're involved with healthcare water counters or in your own businesses, is think about that. Many of you probably that may be online for already. I think if I was to talk about this 10 years ago, it'd be less than 1% of the companies would have this been online for. I think there's a movement now, thanks to our millennial generation that cares about this kind of stuff. We would have a hard time with my number one stakeholder of employees if we didn't have the kind of meaning we have in our business. We wouldn't be successful. We wouldn't be able to attract the kind of talent that we would need if we didn't have this type of organizational, purpose and value. So I can talk about Catalyst Health Network, and if you want to know interesting things about that, we can talk about purpose. But I have like 5 minutes, I think, before we have to go.
First of all, thank you.
Yeah.
Can we take a few questions?
Yeah.
And I also want to just thank you for your leadership. And if I can add one thing to the entrepreneurial piece that happens here at Health Podcasters, as you said, it's a different twist on things, but it's basically a screening device, building long-term relationships on behalf of these startups that have to make a lot of decisions quick to get as many good decisions made as possible without telling them this is who you need to do business with.
Yeah.
So we don't want to be the patriarch telling them here's what you got to do.
No.
But at the same time, we want to make sure that the options they have in front of them are good, solid choices. People will not kill the startup. It's super easy to kill a startup. We've got one, we'll kick it off with an online question from Jim Turner. And he says, what are you doing to engage large self-insured corporations in your model, such as AA Southwest, Dallas Municipal? I don't know if you do or don't. That's the question.
Yeah, we do. I have a deal with Pepsi. I have a deal with, talk to Walmart all the time. We're talking large. The couple things that make it hard. The large companies are often multi-region. Healthcare is local. Companies are broad. There's a disconnect right off the bat, right? So they have to do something local, and that's sometimes hard for them because they want to do something for all. It hadn't worked. So some of the more advanced ones are doing that, but if they are large, they do things in like 2 or 3 year periods. The fun thing about being small-ish, I have 300 employees, is that I can't do it anymore. I used to be able to make decisions like at lunch and then roll them out. You guys, a lot of you guys can do it. You can do that. Now it takes a little bit longer to roll things out. Now, if you have, 100,000 employees across multiple regions or maybe multiple countries, then they're looking at a much longer term. They all engage with us in Dallas-Fort Worth. You really can't. Everyone is hot on primary care. Everyone understands that there's an opportunity to go upstream and get your primary care rather than downstream, where you have like half the costs are in the hospital, pharma, specialist, people are already sick world. Like if you could move upstream and start thinking about it, and it's what Medicare does, but we don't do it for the under 65 as well, is invest in earlier health. There's been wellness programs that have been sold for forever. Those haven't really turned out to be much of anything. And so how do you think about it? And when you are a self-insured large corporation, the other thing is the average tenure, especially now, is only 2 or 3 years, depending on the job for their employees. So are you really going to invest in their long-term health? And the answer is, so heretofore, is no. And so there's just all these kind of misaligned incentives. The good news is we're in a lot of these conversations. Ultimately, I think crystal ball, maybe, with ICRA, which is a way to go from a defined benefit to a defined contribution, that you start to see more and more companies saying, hey, here's your $2,000. I'm an employer. I don't want the insurance game. I don't want to be in charge of this, but here's your money. And with the exchanges that started during Obamacare, you can imagine, if it was me, I'd go out and I'd go get a subscription for primary care, and I'd go get a catastrophic plan online, and with the money that I'm given pre-tax. I hear a lot of companies talking about that and like wishing that would come true. And so it's a matter of, if you see a few do it, they're all scared right now though, because we're in a labor shortage. No one's wanting to do anything other than buy blue. The old buy IBM, no one loses their job. Right now, everybody just continues to buy blue. They don't really want to be disruptive right now. They're talking about being disruptive in 2 years because of the labor shortage. But we talk to them all the time, but there's some color to that conversation.
Blue being traditional.
Yeah, Blue, United, whatever. Other questions? Yes, sir.
So given that in this community, there are maybe four large healthcare systems, plus all the big insurers, why is Dallas needs healthcare costs so high? I don't know, that kind of competition thinking would be.
Yeah, that's a good observation, because you do see 4 and 4, but our metro area is so big. So there is 4 still, and one of them is only like a $2 billion system in a couple of different areas, right? So I'd say there's kind of like a 3.5. And I would say from an insurance standpoint, there's really about a 3, because Cigna's really low. You're like 6 or 7%. So you're looking at more like a 3 and 3, which that consolidation, both of them win when price goes up, right? And then the other thing that I think is unique about Dallas, I mean, Dallas Fort Worth, it's done such an awesome job economically that when your business is good, so if any of y'all have been in or run a larger business, even like me, even though I'm in healthcare, the amount of time the CEO or the CFO actually spends on their healthcare costs of their company. I joke with my friends that are CEOs that run billion-dollar companies. I'm always asking them, like, hey, how's your $30 to $50 million healthcare company doing? And they're like, what are you talking about? I'm like, the $30 to $50 million healthcare company that you have inside your company. He goes, we don't have that. I go, how much do you spend on annual benefits? 30 million, 50 million. Who do you have running? That's a big business. Who do you have running that? HR. How often do you meet about that? Twice a year. And so even though it's frustrating, the costs are so variable, and the CEOs and the CFOs, it bugs them. The Dallas business community has been so successful the last 20 years that unless your business is resource constrained, it doesn't inspire any creativity, like what I was talking about, to actually make a change. Because, the conversations go like this. Looks like you're going to have a 15% increase this year. That sucks. Go back, tell them again, tell them we're going to move. All of a sudden, out of nowhere, it's 9%. All of a sudden, 9% sounds better than 15%. And it happens over and over. And all of a sudden you look up, and after 10 years, your costs double, right? So I think it's because of the success of this community overall. There was a really interesting moment right around COVID where I was getting a lot of calls, and they were like, hey, the one variable cost that we have no control over is our healthcare. We're ready to do something. And then it changed when the labor shortage started. And they're like, ooh, we can't change anything. You had a question first, though, didn't you?
Yeah, I did. Several actually, thanks a lot. This is awesome speech. it's company thinking multiple directions. But one thing is, as an innovator, right? I often run into this thing, when folks say that, you have a solution for a problem. And here I'm trying to disrupt something, right? And I know like folks don't, see it yet, right? How do you stay the course, right? How do you respond to that, right? You have a solution looking for a problem, right? It's not just me, a lot of other innovators are part of this tool, right? How do you respond to that?
Yeah, that's the journey of you as an entrepreneur. That's it right there. To me, is we call those value attempts. It's a fun little term that we like. Is that we're out there. I said I failed many times. I tried. So for you got to go take as many value attempts as right. I'm watching your presentation, thinking about, yeah, he thinks the whole world could take his solution, and you're right. Theoretically, on paper, you got to go make as many value attempts as you can possibly to ping for connectivity. And that connectivity, and then you have to kind of have, like I said, around purpose and values, like what is important to you, what are you willing to say yes or no to, and then what is the other side. Right now, I've launched a pharmacy clinical solutions out of the stack that made us successful on Catalyst, saving $100 million. We've pulled that out, made it its own company. It sells to right now health plans, value-based provider organizations, concierge doctors. I mean, I got all kinds of segments. And I don't think we always will be in all of those segments. We're in the moment as an entrepreneur of testing doing value attempts on different segments, just and looking at the product design. Our product team is doing different feature sets for each one to imagine what might be the stickiest and the most profitable and the most valuable to the customer too. So to me, you're exploring all of those master segments, and don't feel bad about that. That's part of it.
Yeah, so value jump. So I think that's an awesome term. Thanks.
No, we don't have to worry about him. Go ahead.
Okay. This is kind of a broad question, but how do you feel the regulatory environment right now, especially as it's changing over COVID, is it affecting your business?
It goes back to that question I think that's what I was going to say about the podcast. People ask me all the time, what's your biggest challenge? The biggest challenge for us has been since we've started is the status quo, period. And the regulatory environment is a piece of that, because in a lot of ways, some of the things they do to try to be, in some ways, they've really helped primary care get to the top. That's good. But in other ways, they solidify, because if you look at where all the lobby dollars come to, they solidify the positions of some of the biggest players in the status quo. They solidify and protect pharma. They protect the hospitals. They protect certainly the carriers, And so when those big lobbyists are keeping these, in healthcare, there's really, from a market standpoint, there's only three stakeholders, using that term again. There's the people and organizations who provide care. There's the patients who receive care. That should be the number one stakeholder. And then whoever pays for it, which is unique. Everybody else is just trying to take $1 out, and they're not actually adding $1 in usually. So where you all are trying to play is how can you be valuable in that, right? Because you're not necessarily, most of you aren't paying for, providing, or receiving care. So what are you going to do to help those stakeholders? And policy today is all around keeping what I would call the non-value add stakeholders, but they have all the money in place, because it's this negative cycle of I got the most money, so therefore I have the most influence, and you want to get me started on term limits and all kinds of stuff with politicians and policy, then that's a whole nother talk I could give.
Well, first of all, everyone is excused. If you need to run, it's 9. But under no circumstances will I let Chris Rowe go until he asks.
Yeah, I mean, if y'all have questions, I'm good.
I'd like to stay on longer, and there are questions. I'd love for. I think this is Jim's question.
Yeah, that was his.
We had that one. Any other questions?
Okay, Patrick, what is it?
What's the biggest changes you come in healthcare with this?
Biggest changes coming to healthcare in the next 3 years. That has there's two answers that just pop into my head. One is I would say it depends on what the legislature what the, Congress looks like coming out of 22 and looking at 24, because you're almost in that 2-year window. That matters on a lot of things, and they can go a lot of different ways. The other thing I would say is that the digital revolution is now. We're living in a historic moment of digitization of healthcare that should have happened probably well over a decade ago, like it did, and everything else. I mean, these things popped up and started living with us, 12, 15 years ago. And it's just now kind of getting to the healthcare world. So I think the imagination of how we interact and healthcare moving out of the hospital and into the home or wherever you are is the biggest change. I mean, so much, the physical location of care seems to be getting irrelevant. And so I think that's the biggest thing I see is it's going to be interesting to watch. Like I tell people all the time, the one place I don't want to be in healthcare is running a hospital. Like that's they're going to fight like crazy, but it's going to be a hard place to reconcile why you have to go to a hospital for much in the future. Off the top of my head, yeah.
Chris, thanks for sharing something a bit deeper. Really resonated, just the tactical. So I appreciate that. My question is, was your why or your purpose like very obvious of communities thrive? How did you get there with like other competing?
Yeah, great question. I'll tell you, I'll try to answer that, and I also don't know. Right, and it's kind of like, I don't know, why'd you married? I am. Why her? Right, just happened. Right, yeah. How did that happen? I don't know. So here's what I'll answer. How I answer your question is that that's why I told the story of Hillsborough. I think our experiences are building things in us that connect, that we don't appreciate, we don't know. It's hard for us to know. Sometimes you have to look back at the breadcrumbs because you didn't see it happening, the old hindsight 2020 thing. And then I tell people this all the time. I used to say it more because when it hit me, it was literally, it was moment-ish. Like it wasn't something that evolved. It just was like, it hit me in a moment. And I'm so thankful to God or Spirit or whatever, the world for that moment, because it just felt like so congruent for the rest of my life. Rick Warren has this purpose book where you spend 40 days trying to find your purpose, right? And I don't know if that works or not, but I do know, and my wife laments sometimes too. She's like, man, it's just so cool that you seem to really, really have an understanding of why you're here. And she's like, I don't know that I always do. And I'm always trying to help her with for kids, and we're doing this and we're doing that. But even her, it hadn't gelled. This where I'm going to this afternoon for the rest of the day. That group of tribes people have kind of had that moment too. But I think it comes from making sure, to me, is there's a lot going on inside of us, and these things keep us from actually going inside, keeps our attention outside. So there's just something to having whether you call it prayer or meditation or whatever, just solitude, to listen to what is inside of you. Not promising this, but over time, if you do that enough, these things emerge. There's a conversation going on with you and the world inside of you that you just have to slow down to hear it. I slowed down enough to hear it. That's how I explain it.
So one of the price transparency has become a big topic, but it seems to me, particularly in a hospital environment, that for among other reasons, if you don't want to share prices like that, is that you truthfully don't really understand the costs. They don't really understand what it costs to deliver care. Are you guys working on that in your organization? your network, things like that? That's what you guys have a good handle on?
Yeah, going back to Patrick's question, that's actually something that could change some things. Interestingly, is the price transparency. It also connects to inspiring creativity about being resource constrained or not. Yeah, we absolutely work on our costs and understanding them because we are resource constrained. You know, primary care physicians aren't making a lot of money, so you need to, relative to the rest of so you have to understand your costs, and so we do that. Hospitals do not do that. To your point, they do not understand their costs. They understand their revenue. For the most part, I'm doing some stereotypes, but down to the unit
I'm not
business,
sure they even understand that, but
business unit economics. Yeah, they don't have to. That's my point. They don't have to. They're not resource constrained. Resource constrained helps you be more creative. It just does. When you're in a pickle, you stop and think a little bit more than when you're flush. Forest Park, great example. Way too much money. Zero thinking about what's going on operationally, other than how do you keep the money coming through the top? And a lot of the not-for-profits are the same way. They're looking at their revenue line. How do we grow our revenue? You all, well, maybe you all are thinking about how do you add revenue? I get it. But once you kind of get going in business, it's not just your revenue. It is understanding your expenses. And so we look at that very closely. And as you talk about this pharmacy business that I talked about a little bit, I mean, there's so much ridiculousness in that, and understanding the unit economics of different pieces of the value chain in pharmacy is really important to how we're solutioning to those multiple stakeholders. So the answer to us is yes. Hospitals generally, no. But price transparency is not about, this is what's, I'll connect that back. Price transparency is not it's not directly connected to whether you understand your costs or not. Price transparency is going to be that you guys are going to be able to see that, you know, the difference between what Blue Cross pays hospital A or B and United, and Aetna, and Cigna. And the hospitals are scared to death of that. And to be quite honest, so are some of the carriers. So what's going to happen, this is going to be really interesting, going back to your question, it's going to be really interesting this summer and going into next year when THR, Baylor, whoever, has their pricing out from Baylor, from United, Blue Cross, Cigna, and Aetna, and you start seeing these discrepancies. What's going to happen? I don't know. I talked to a national hospital system chief strategy officer last week, and they were talking about like canceling one of their plans with one of the big payers because they did not want that price to be in the market because it was so much lower than all their other carriers. Interesting. Like little bombs going off everywhere. It's gonna be awesome. Get your popcorn ready.
if you were really in the acute care environment now, what would you be doing to slow down the rate of like burnout and excess, caregiver burnout and excess?
If I was in the acute care, so let's make sure we're talking the same thing. Hospital setting.
Hospital setting.
If I was in the hospital setting, how do you slow down burnout? God dang, I don't know, man. You got let's look at what you got. You got a flow of more business coming into with COVID. You have the honorable way you're treated, whether you're a nurse or a doctor or whatever, by your consumer, who's now flowing in more than ever, is its lowest point. It's like, I mean, you got airplanes and ERs, right? You have people quitting, mass exodus. Every Monday, we're growing like crazy. We always have 4 or 5 people every Monday. This Monday, and I always walk in. We do a town hall every day from, I didn't do it today, from, they did it, not without me, from 8:40 to 9 o'clock. Entire company online talking about something every single day. Mondays is our first day. And I had a new employee who's going from an ICU nurse at Parkland to being a care coordinator in my business, which is going to be great and cool for her, but that's a massive change. She's like, I just couldn't do it. Right. So you've identified the problem there. I have no idea how you solution that. And it could be one of those things. But again, when you get resource constrained, you get creative. And so this push in all parts of the pandemic are going to, I think, allow for something new to emerge, but sometimes you have to go through the pain. Most times you have to go through the pain to have real transformation. So I don't have a solution for that one. Goes into the category of why I don't want to be a hospital CEO either right now. Somebody else have, yeah.
You had brought up the phone, of course, the big push for privacy of data, et cetera. And the European patient data laws are much stricter than here in this country. What role do you think, and how significant that is for patients to be able to control their personal health information, determine who gets to see it?
Yeah. Those of you on the technology side, I'm not a, Patrick's not here anymore, but he could tell you, you know, I know how to like restart my computer. That's about it. So I'm not the big technology of all the different levels of that. I have friends and certainly a big team that does that. I wonder if the cat's already out of the bag. Like literally, like, does everyone already, I mean, somebody, like when I can look at my phone in a little bit, something will pop up based on like what it heard me say.
Well, and that's why the Facebook and, you know, some of the ads.
Yeah.
I use Apple.
I think it's, your question is important. And it goes back to things I don't understand how to fix, like this burnout thing. It's like, I just wonder if it's already out of the bag, and can you put the genie back in the bottle on some things? I think you can make more protections, but it seems like, you know, anybody can hack into anything these days. Like it's not a question of when or if, it's when your organization's gonna get. It doesn't matter who you are, whether the government or Visa. You'd think that like the most solid, secure places in the world, they're getting hacked. I don't know, that actually is one of those kind of troubling things that you think about, that, you know, where do the next world war start over something like that? Yeah, I don't have a good solution on that one either.
There's also a term that's big around, which is social health, right? And it's like we have had, you know, folks approach us saying that they want specifically have, you know, a person's health record shared by, you know, the entire community, right? Because that way they can try to say that, hey, I'm doing better now, whatever, and they want the entire community to help them go through it, right? So which I thought was almost like counterintuitive, but that is being asked for social health.
Yeah, no question. There's way more than goes into your health than what we provide in healthcare. I mean, it's like 20% of our total cost of care is actually about your health. It's about where you live, and, you know, what's your mental health like, what's your family situation like, what's your income, what's your social support. I mean, all these things that don't have to do with whether or not you're taking blood pressure medicine. That's important, but all these other things are maybe more important. Like when we're working with down in South Dallas, it's housing first, and then it's how are you on kind of mental health, substance abuse second, and then we might get to your blood pressure, right? No one's managing their diabetes if they're massively depressed or schizophrenic or on the street. Not happening. Yet they're utilizing tons of our services as a taxpayer. So there's a connection there to our businesses and to the overall, going back to helping communities thrive. I didn't talk about this, but when I think of helping communities thrive, I think of three pillars: business, healthcare, and education. They are interrelated. They all impact the other. If you're not healthy, you can't have a great job and a career. If you're not healthy, you can't learn. If you can't learn, you can't have a job, right? If there's no jobs, that's going to create its own health issue. So they're integrated. They're all interrelated there.
That's true. Hospital is absolutely the highest place to get, you know, hospital care, either, you know, surgical ed or ER. Plenty of experience myself, having been a hospital CEO, and yet it's sort of an epicenter where, you know, people don't have another source of healthcare, right? So I, probably everybody in this room has the opportunity to make a decision about where I'm going to go get my healthcare with my insurance card or things. How do we solve for that piece of the population that does and then relies on the ED or some other outrageously expensive form of care for their mental health, for their primary care, for almost everything else.
Yeah.
People are going to ED for these days. Yeah.
Yeah, I think that's one of the most exciting opportunities for entrepreneurs in healthcare.
And it
today.
thrills me, right?
Yeah,
To
thrills me.
Try to help figure it out.
It's why we have a foundation that's going down there and I'm in the value attempt mode in South Dallas right now. We started with testing. And we worked all through 2020 with different churches, African-American churches in South Dallas. Learned a ton. I mean, a ton. My Hillsborough charisma doesn't necessarily play the same there.
They're not looking for charisma.
No. And they have scars. We all do. We all do. Right. And so going back to what was my first core value, relationships matter. So I spent 2 years just trying to build relationships before I can actually bring solutions. It's one of the things you'll figure out.
There's, and I'm pretty good because I do volunteer for homeless population. Literally a guy sleeping on the street a block away from you right next to the parking lot. In some big tent.
Yeah. And so who do you partner? So in that case, it's like I do a lot with City Square. So we're partnering with City Square on a lot of different things to try different things. See what works, right? And we're just one of many that are doing that. And we're healthcare wildcatters just moving to them. It's moving to a spot where it's going to have a lot more brain power than just in this four walls. And so, I think there's a lot of energy around trying to solve those problems, but it's going to take, it's not going to be a single solution. It's going to be local.
Right, I was going to say,
Sure.
what you said, healthcare is local.
It's going to be local. It's going to be local, and it's going to be boots on the ground. And it's really not going to be physician oriented. It's going to be physicians will play a role, to use a sports analogy, and I'm criticized for using too many sports analogies. You'll just be like, physician just might be the, a linebacker on the team that's used several times, special teams now and then, right? Because it's a relationship based. People make decisions based on their closest set of relationships. And in north part of the Metroplex, you might have more opportunity to have a primary care physician, but in the deserts, you don't have that. And so what can be a substitute for that? Well, you have churches and elementary schools, community centers that are trusted. So how can you use that vehicle of trust transference as a way to bring care delivery virtually and physically? I mean, those are the things we're playing with right now. That's what we're doing with our foundation. We'll launch 2 sites next year, finally, on and taking care of probably like 100-ish people in a virtual care team model that we use in Catalyst, and see how we do it. And I wanted to do it 2 years ago. And what's interesting is what I didn't know then is I know now. I'd have been thrown out. It would have never worked. Because the relationships had to take time to organically evolve, to understand and listen to what their needs are, rather than me just coming in saying, here's my solution, let me fix your problem. It's not the way it works.
Their trust comes from your transparency and vulnerability to their concerns.
Over time. That's it. Over time. And consistency and walking your talk and showing back up over and over and over again the way you said you would. Which means you have to, it's a different investment cycle. I think of it in 10 to 20 years, is what we're doing.
It's not transaction.
It's generation change. If you're in generation change, how do you match the resources to something you're trying to change over a generation? It doesn't fit necessarily into a VC or PE type usual time frame. Although you're seeing more and more investors who, I'll tell you about one right now that I'm kind of working with on the pharmacy side. Anybody heard of Main Street Health? Okay, Main Street Health. Brad Smith, become a friend of mine out of Nashville. He's a young guy. He got some money from Dr. Frist, Senator Frist, his venture firm built this company called Aspire, sold it to Anthem for hundreds of millions of dollars. So he's sitting on hundreds of millions of dollars. And he's like, what's the really hard problem? He goes, you know, I grew up in rural Tennessee, and you should talk to him. I drove around with, I can't remember what senator it was. He was on a senator's staff, and he was like 21 years old in college, and they would drive around, you know, because they're always campaigning. And he would just see this awful the awful health of the rural communities. And so he's like, I got hundreds of millions of dollars in my pocket. I got all kinds of it. Oh, and he spent a year at CMMI in Trump's last year. So he's got that visibility and connections now. He's like, got connections, I can get to anybody. Why don't we go try to take care of like the hardest rural areas in the country? Not Hillsborough, Texas, that had 3 doctors. Let's go to where there's 3 or 4 counties that has 1 doctor, right? And there's plenty of that across America. And how do you, as you said, like the health opportunity there is so poor. And he's like, I can spend the rest of my life doing this. And it's going to take that long, and he's got the money to do it. And it's going to take something like that, because there's not a quick turn business model to go public in 3 years with that. From what I can tell. But there's people smarter than me that are creative that maybe can find it. But I don't think this solves many of those problems.
But not the purpose.
Now its purpose.
Yeah,
And it goes back to his childhood.
I was going to make a comment just on that, you know, and also, but when we're talking about, you know, what drove you, the purpose, you know, I think what I've learned that purpose is all about giving, whereas goals are all about more about taking. Right? So when you make that transition, that's when the purpose really comes into focus. And you know, obviously, you will still benefit from it, but the purpose-driven life is when you start to give out, reach out, and that becomes a lot more easier way to connect with your subject, right? It's not about you. Right? So this is kind of what I've learned.
Yeah, that, you know, in business, you can be very transactional. It just depends on the kind of business you're in. You know, sometimes, you know, finance has a bunch of, and there's a lot of tech now that's just transactional type of stuff. And how can you make the transactions easier, more efficient, more cost? That's fine. But if you're dealing with humans in any way, certainly the tech is appreciated, but the relationship is always just, I mean, we're still just people talking to each other the same way we were 1,000 years ago. And so you have to solve for that somehow. And if you over-index by being too self-oriented, that relationship isn't going to last very long. Better make hay on one transaction, because you might not have the loyalty or the trust for a continued. I mean, that's more than ever today. You know, think about Net Promoter Score and how popular that got. It's all about building the trust in your brand that you represent what you say you represent over time. And if you don't, like one of the most painful things we do, you know, I talk about relationships matters, but that doesn't mean we get right all the time. It's just really painful when we don't. We don't always honor every single relationship in a win-win-win era of time. It's just impossible sometimes. And you have to have a tough conversation. It could be an employee, you know, it could be a partner from a physician standpoint. You know, I'm cutting a physician group loose right now. And I sat down and had coffee with them last week. Said, man, I hate doing this because it's really hard from a relationships matter standpoint, but our strategies just aren't the same. But that's what you have to have there's other things than just that, but you take it through that filter first. And sometimes it takes too long. You know, there's shadows of all your strengths too, right? The shadow of that strength, well, that kept that group too long. And that wasn't winning for them too, because they could have gone off and done something better probably too. All right.
Thank you.